Medical Coding Fundamentals, Chapter 11, Radiology. Radiology is a branch of medicine that utilizes various imaging techniques to diagnose and treat diseases. We have our X-ray films. This involves an X-ray detector upon which an X-ray beam is cast to form an image of the body plane being examined. Digital X-ray system uses computerized data for radiological imaging instead of film. Computed tomography, or CT, uses multiple X-rays to produce cross-sectional images. An MRI uses a powerful magnetic field and special injectable materials to produce images. The positron emission tomography, or PET, measures a functional activity of a specific organ and body tissue by injecting radionuclides into the venous system and measuring the activity in various anatomic structures. Ultrasound uses sound waves to create a permanent image and measurements of the body parts or as a guidance during other procedures. Nuclear medicine involves placing radioactive material within the body and then monitoring the radioactive emissions from those elements. Fluoroscopy is real-time images of the body using an X-ray source and a viewing screen. Positions, projections, and planes. Images are described by anatomical part, the patient's position during the imaging, and the direction of an X-ray beam. We have several different positions that we use for radiology. We have our standing. We have supine, which is lying on the back side. Prone, lying stomach side down. Decubitus, which is lying on the side, and oblique, lying between standard positions. Beam directions. This begins where it enters the body and ending with the part of the body closest to the film. So our anterior posterior is when the beam enters the front of the patient's body and exits the patient's back. Posterior anterior is when the beam is at the patient's back and the film is placed along the front side of the patient. Right and left lateral decubitus position is used to describe situations where the beam enters one side of the body and exits the other. Computerized imaging. This utilizes a computer to combine thousands of individual images into a composite view of the body in a particular plane. Tomography uses two-dimensional image of a section of a three-dimensional object. Your anatomical planes include the transverse, which is a view of a horizontal cross-section. Sagittal, which is a view of a front-to-back cross-section. And coronal or frontal, which is a view of a side-to-side cross-section. Reporting radiological services. There are times when you may have to report these services as a separate procedure. Now, these are codes that contain the terms separate procedure, and they should only be used when a particular procedure is usually performed as part of another procedure, but for some reason was performed independently. You will also be using a modifier 59 in this situation. Radiological supervision and interpretation indicates professional services often reported by non-radiologists as part of other procedures. Unlisted codes are used when the particular radiological service provided is not described by a specific CPT code. It describes services such as fluoroscopy, CT, MRI, radiological, ultrasound, therapeutic radiology treatment planning, therapeutic radiological treatment management, clinical brachytherapy, and diagnostic nuclear medicine procedures. Documentation also needs to be provided that describes the procedure, the need for the procedure, and the time, effort, and equipment necessary to perform the service will also be necessary when using an unlisted code. Modifiers. Modifier 26 will be used to describe professional services. TC will be used for technical component, and this is used by entities that own or lease their own equipment. Anatomical modifiers, right and left. Bilateral procedures are also included, and that would be modifier 50. Sections. We have diagnostic radiology. This is the anatomical region will be coded first, then by the service performed. Sections are grouped according to imaging techniques. We have our diagnostic ultrasound, which will include the anatomical subsection, complete versus limited exams, guidance during other procedures, and the type. Now, types include the A mode, which is a one-dimensional ultrasonic measurement, M mode, which is one-dimensional ultrasonic measurement with movement of a trace to show the aptitude and velocity of the moving structures. B scan is a two-dimensional ultrasonic scan with a two-dimensional display. And a real-time scan is a two-dimensional ultrasonic scan with two-dimensional display of a structure and movement with time. Radiological guidance. This is imaging techniques used as guidance when performing other procedures. Subsections are based on imaging techniques utilized. We have our breast mammography. You'll need to know bilateral versus unilateral procedures. Add-on codes are reported when the computer-aided detection is used to analyze digital imaging and to identify potential lesions. We have our bone joint studies. This includes bone age studies, bone density studies, MRI studies of the bone, blood supply to the bone marrow. Radiology oncology. This is radiological services used to treat certain cancers. The stages involved include a clinical treatment planning, treatment simulations, medical radiation physics, dosimetry, treatment devices, and special services. We have our radiation treatment delivery, radiation treatment management, positron beam treatment delivery, hyperthermia, and clinical brachythermia. Okay, nuclear medicine. This is placing radioactive material within the body, then monitoring the radioactive emissions of those elements. Okay, homework for this week. Please read Chapter 11. Complete using terminology and checking your understanding at the end of the chapter.